As we've been showing you this morning, 29-year-old Brittany Maynard is starting a national conversation about choosing the way to die. Maynard has terminal brain cancer. She moved to Oregon, where doctors are allowed to help patients end their lives. In her first television interview, Maynard explained her choice to Jan Crawford.
I don't want to die. If anyone wants to hand me like a magical cure and save my life so that I can have children with my husband, you know, I will take them up on it. But we haven't been able to find that. And the way that I would die, just according to this disease, is terrible. The availability of being able to take a medication that allows me to slip into a sleep in 5 minutes and pass away most likely within the half hour sounds a lot better to me, just as a human being.
Our Dr. David Agus is director of the Westside Cancer Center at the University of Southern California. He has treated patients with Maynard's disease. Dr. Agus, good morning.
Good morning, Charlie.
Obviously, we want to hear your thoughts on the controversy about how to handle this, but what does she face medically and psychologically and physically?
Well, glioblastoma is a disease of the brain, and it's important to note that it's different in everybody, depending on where in the brain it happens. But as the disease progresses and it gets larger, there are symptoms ranging from seizure and an inability to be yourself, perform the activities that we all do in our life, and losing our dignity many times.
Dr. Agus, Brittany speaks so eloquently, it almost makes you wonder if she's better than she thinks she is. Or is this a symptom, or her symptoms going to progress dramatically in the next few days or weeks?
You know, I think we can be fooled many times. Cancer patients can pull up the guts to do what she did, and in such a beautiful and heroic fashion in that interview. But the disease is real. I don't know if you saw the MRI in the piece earlier, but that disease was a good portion of her brain, and it's just getting larger exponentially. So the disease certainly will win here. I don't think that's disputable.
And Dr. Agus, there are currently only 5 states where aid in dying is legal. In those other states, what does the medical community offer for patients like this who are terminally ill?
Well, we can alleviate many, if not most, of the symptoms of advancing cancer. And we can take away pain, we can take away, symptoms that you may have. But at the same time, we can't restore dignity. And it's very important to distinguish those two. I look at the Brittany story, and again, she's a hero for what she did, because she brought this to the national discourse. But I look at it as an indictment, a failure of the medical system twofold. One is we can't treat this horrible cancer. And the second is she and most cancer patients don't trust physicians to be able to alleviate most of the symptoms at the end of their life and restore dignity till the dying process.
So knowing what you know, if you were a doctor in Oregon and she came to you and said, this is what I want to do, what would you tell her?
Well, first, I'd go through what I could do to alleviate her symptoms, but it is her value system, and my job is to educate her with the facts, and then she makes the decision based on her value system. It's not the role of the physician to tell a patient what to do. It is a partnership, and based on her value system and what she believes in, she needs to make the right decision for her.
Thank you.
Thank you, Dr.
Thank you.
David Agus.